Here's the big question this show answers. How do we leverage technology and human science to positively impact our personal and professional life? The Tech Human Experience has the answer. Here's your host, Inc. 5000 tech founder, neuroscience junkie, and Navy SEAL wannabe, Javier Guerra.
Hello, my fellow tech humans. Today's guest is a Chief Information Technology Officer known for his impactful work in the medical industry, where he combines the precision of technology and the compassion of healthcare. He's a University of Texas alumni and a guiding mentor at South by Southwest in Austin. He brings a unique blend of expertise in enterprise software and healthcare consulting. Please welcome Merced Gonzales. As always, thank you for your time today, Merced. Really great having you on the show. Looking forward to our conversation.
Thanks for having me, Javier. Appreciate it, and look forward to talking to you. Thanks for thinking of me.
Absolutely appreciate your time for sure. So let's get started with an important stat. Clinical wellness through automation. A survey by Mayo Clinic Proceedings found that 54.4% of physicians reported feeling burnout. Automation and administrative tasks could alleviate this burden. For instance, an AMA study highlighted that physicians spend 49% of their time on EHR and desk work. Merced, in your experience and your expertise, have you observed any measurable changes in the well-being of job satisfaction of clinicians after the introduction of automation in administrative tasks, so to speak?
God, I think what you're saying there, I think we've come a long way in it, but man, I believe we have a long way to go still. COVID really shed a light on a lot of that when not only our physicians had to be in hospital environments and at times had really long schedules and shortage of other providers, but then they were supposed to document everything that they are doing, and so doubling their time away from their families and their homes. And so for us, when we started HNI as a company, we really started off HNI we wanted to be a technology company. That was our focus. Let's build technology around what an inpatient doctor does, or in our world, what a hospitalist is. And so it started off like, well, what are the things they're doing every day? And we saw that they were going to the nursing stations, printing up censuses, identifying where their patients were at, and they were going around and they were looking for their patients. And so we started building technology to kind of, let's help them with their workflow. And let's tell them where those patients are on these little handy devices you have in your hand, or your iPads, and walk around and give them all this meaningful information. It started off as, hey, let's really this will really improve their lives, and then it ended up being we're adding more information for them they needed to give us more information about every one of these patients, and so it kind of became a thing where, help me help you kind of a thing. Tell me what it is that you need, and what can I take off and what can I automate? And so we really started to learn about what it is our doctors were doing, what types of things in the documentation process could we take off the plate for them. Could we get them, save them the time having to go to nursing stations and printing up things and writing notes on a sheet of paper, handing it to a biller or somebody who is going to document everything for them. Obviously, the goal in all of it is so that they went to school to be a doctor. They want to help people. They don't want to be on their computer, doing these things. And so for me as a tech person, it's been really difficult because I want to build technology. I want to get it into their hands. I want to improve them. And at the same time, they're the ones who are saying, hey, I've got too much tech and it adds to my day. And so finding a balance of providing them tools that are really beneficial for them, that's beneficial for the patient, and then for us, it ended up being, what can we do to quantify that? How can I show to the provider that what they're doing by using these tools and these technologies, how is it improving their day-to-day documentation And how is it making a difference in some of the hospitals that we are providing services in? I mean, in some of the hospitals, it was a matter of keeping the hospital open in a community that's underserved. So I think to answer your question, well, I've just kind of gone all over the place there, but I think to answer your question is it's a lot has to deal with good communication, understanding what it is the provider needs. Tell me what it is that you need. Explaining to the doctor the benefits of using this technology and how it can help them in their day-to-day, how I can show the value that they are providing to the hospital that they're serving, and then ultimately to the patient. And the goal obviously is to get the patient well. Let's get them home. Let's get them back to normal life. And do it as efficiently and cost effectively as possible for everyone involved. You know, the provider and his time, the hospital and its resources, and the patient. Get them home. You know,
Yeah.
get them well. So that's a tough job.
Yeah, yeah. And when you're talking, this hits home for me. A lot of things are coming up, and I'm going to try not to go on too many tangents here. But I studied medicine in school, right? I've done a lot of research in medicine and been trained a lot in emergency medicine. Served as emergency medicine. I've served in ERs. I've served in ambulances. All this kind of stuff. And so I know a lot of information about the healthcare industry, the medical industry, the food industry, the pharma industry, and when I was going through school and going through my education, getting trained in medicine, I was like, I don't like to type. I don't want to learn how to type. And so I was like, as doctors, they don't need to type. They just use this software and they talk into it. But it wasn't as good as, it's getting way better now. But back then, I struggled a lot because I didn't learn how to type. And the technology just didn't advance as much. I had the Dragon software, I had all this stuff, but it just wasn't as good back then. So I went through a lot of pain because I didn't think I was going to need to know how to type, right? So it brings that up, but the way that I'm wired, I'm just continuously looking at improving things. And so I'm doing these exact things of how can I become more efficient with technologies, right? And I mean, that's what Tech Human's about, bringing tech and human science together to create better outcomes, right? And so I'm constantly looking at this, and it's mind-boggling to me, the advancements in technology now that have just happened within the past 12 months, right? It's just like, if I'm in that position, like, it's hard for me to fathom what is it going to look like in 3 years, 5 years now, because it's accelerating and changing so fast. But the tools at our disposal are so powerful. And the way I like to look at it is like, how can we leverage these to automate things? It scares a lot of people because they're like, oh, it's going to take my job and this and that. But at the end of the day, like you said, the doctors want to provide a good service to the people. Like, they are trained and they are passionate about doing something that is not entering stuff into a computer or whatever, right? So if we can automate those administrative tasks, how much more time and impact can they make to really connect with those patients and really understand and really leverage their strengths to provide a better service? And how can we trickle that through the entire process, right, to bring that value to the end user? So it's exciting. It's very exciting to what you guys are doing and what's going on in the world, because it's all just like a huge opportunity to improve things on a lot of levels.
Some of the things you're talking about, the typing, to when we were writing our application that we currently our providers use it every day. We have about maybe 18,000 encounters a week that we're capturing, and it started off, there was some typing involved, and then let's get rid of the typing, put some radio clicks, and then, oh, there are too many buttons, too many, you got to get rid of the buttons. And now it's back to, there's so many great advancements, like you mentioned, about the ambient listening, where you could just bring your iPhone into the room with the patient, and you can just start doing your histories and physicals. You can do your examinations, your E&Ms. And as you're doing it, it's just listening, and it's documenting, and it's putting it in a way that we can actually use the data. We can put the discrete data elements into the right places, getting the right CPTs, that we need, getting the right diagnosis codes and putting it into place. And ultimately, still, it has to go back to the doctor to confirm and say, this is exactly what I meant. But it definitely is getting better, and it
Yeah,
requires
it's
work.
way easier to go and verify that the information is correct versus having to input it all yourself. And yeah,
Right.
so
And a lot of them were going back to their home or back to the stations or to finish their notes, and they forget some of the things that happened. And so there's a lot of benefit that technology is bringing in, not only to the provider and those documentation, but also to the patient, making sure we're capturing everything in a safe and secure way.
yeah, and
So that,
it's the way I look at it is like service makes the world go round, and if we can leverage these technologies to provide a better service and not miss things, right? Like you said, we forget, right? But if we have this technology there capturing everything, like you're mitigating that risk, right? So it's huge. It's exciting times for sure. So let's dive into today's topic, technology as the heartbeat of modern healthcare. In this episode, we'll explore the forefront of healthcare IT, examining how emerging technologies and data analytics are revolutionizing healthcare efficiency and decision making. We'll also discuss the challenges and opportunities in cloud computing and the future of tech development in healthcare. So let's talk a little bit about innovations in healthcare IT. This is an area that we come across a lot, right? Our largest client base is healthcare IT. And so, again, in my background in medicine, this is something that I'm passionate about, right? This is human science. I'm the human science nerd, right? And it's exactly why our company is called Tech Human. But in relation to these innovations in healthcare IT and what you guys are doing, in what are some of the cutting edge technologies that you're currently focused on implementing?
well, I think one of them I mentioned, the ambient e-note taking is something that we're exploring right now as well. We have multiple different types of notes for the different types of patients in the different types of facilities in which we're serving. When we first started off, we were doing most of our work in our inpatient acute hospital settings. So these are the patients who come into the ER, but then need to be admitted to the hospital because they're going to stay for a little bit in the hospital. And so we're managing their lengths of stay. But as we're discharging those patients, hopefully discharging them home, we needed to continue to follow up with them. And so we needed to add some additional innovation to what it is we're doing, to add new tools so that new specialists and new providers can actually follow those patients in their new environments. I think about that ambient is really exciting because now our providers will be able to just, turn on their phone, be able to document, and it'll create an electronic note. From that electronic note, I can get all the elements that I need so that I can, take care of the patient's medical, be able to do their labs, do an order for their labs, do an order for their pharmacy, or get their medicine ordered. There's a lot of things that we can do from once I got the data in discrete data elements that I can play off and riff off of. But I don't know, you said the word innovation, and I keep getting hung up on the word innovation because it becomes kind of a buzzword, innovation.
It's a loaded word.
Yeah, I mean, that's what technology is, right? It's constantly innovating. It kind of gets overused. That's the world we're in. I kind of get back to just listening again to the patients and listening to our providers and who is your real customer and what is it that they need, and it's listening and just trying to identify if there's a problem there. Maybe there's a really quick fix that we can put into place. Our team is pretty nimble. We have a team of developers here in Austin, Texas, where we do it all in-house. And so I think it's really great for our developers that they hear an idea, they get feedback from our doctors, they go to work, they put something into play, they see this innovation come into play within a month. and it's in the doctor's hands helping a patient. So I think that's exciting for the providers, that what they're saying gets is being heard, and that our developers are seeing that the work that they're doing is actually being put into place, and they're able to see that pretty quickly. So I think innovation is, again, it's such a buzzword, and I think it's a great thing. I think as long as we continue to identify problems. In fact, I like listening to the complainers. Like, we have some of our providers who just complain, but man, it's the people who are complaining that are identifying things that, that's fine. There's probably something that we can resolve right there. There's a problem that could be overcome. So let's just dig into that.
Feedback is huge. It's definitely huge. And it's, I mean, the way I perceive innovation and what it means is just basically just continuous improvement. It's continuously providing better service and continuously improving however you can, and increasing efficiency, all the stuff that we've been talking about, right? It's just driving that change forward, thinking outside of the box of how can you provide a better service for everybody involved, and move the needle in the direction that you want to go to continuously improve.
Actually move the needle, actually help somebody. There's some innovations that have been done that's a great idea, and it never gets put into play, right? Or maybe before its time, that type of thing. But we try to do it little bit by bit. Identify an issue, hear a complaint, let's identify it, let's see if we can resolve it, get it into some sprints, and let's start pumping out the code so that we can get it to publish and get it into the doctor's hands.
Yeah, so I'm thinking about data and the importance of data and analytics, and just data governance, reporting, all of this stuff. In relation to that, like how does your organization really leverage data analytics tools like Power BI to monitor and improve hospital performance?
It's funny you mentioned Power BI, because we are pretty heavily involved with Power BI. We're a Microsoft shop, so the way we created our environment and our world was, did we want to go down which development path? We decided to go with Microsoft tools just because of just the wealth of information that's out there that they provide when it comes to a development, to a developer, and from a development standpoint, and they give you a lot of free tools as well at the beginning when you're a startup, and then they get you, you're using their tools, and then they've got you. But when it comes to the data and analytics, it really became important for our providers to understand what it was that they were doing, the levels that they were coding, and the diagnosis codes that they were specifically choosing for the days that they are visiting a patient, because it's what they are putting in is creating a bundle of diagnosis codes that's going to affect the amount of reimbursement that the hospital is going to get for that particular patient. It's also going to justify his billing and justify his level of acuity when it comes to billing. And the two should sustain each other. The amount of coding and the amount of documentation that he puts should justify the level of coding and billing that he's done. By getting those two to balance, and then showing our providers in real time how they compare not only to their historical coding and how they've done, how they compare to other doctors within the same four walls of the hospital, in real time, showing them how they are billing and how they're coding and how their lengths of stay, what their case mix index is, and what their clinical outcomes and severity of illness and risk of mortality scores are, compared to the other providers, not only in the hospital but to national benchmarks, allows us to kind of really get the hospitalists or our providers on board to kind of see that what they're doing is important. That little data entry that they might have been complaining about is justifying the hospital's reimbursement. It's taking care of the patient so that they get the resources that they need while they are in the hospital, the hospital's getting reimbursed, the hospital can continue to remain solvent. And those doctors can then, if they are documenting accurately, it's going to show up in the analytics, and it's going to show the value that each one of those providers are providing, not only to the hospital, but to the team of doctors working together side by side, to the consultants, and obviously to the patients. And so data analytics is really important. We have all of our information being put into big databases. We've developed our own large language models. We're building AI on top of it. We use Power BI as well on top of it day to day to show how one facility is doing, how each provider is doing within the facility, how they're doing within a payer mix, like how they're doing with their Medicare patients, how they're doing with their commercial patients, how they're doing with certain disease states, how their sepsis patients are doing compared to national benchmarks. And so for us, data analytics was one of the important byproducts of building the tools and the applications that we wrote for our doctors, so that they could, as they're rounding day to day, keep track of what it is they're doing, show them, the value of what it is they're doing, and then prove that to the hospitals that we're serving, with data that's not anecdotal. Sometimes sometimes doctors say, "Hey, I couldn't get the patient out because I was waiting for a consultant, or I was waiting for a lab result." Well, why are all the other doctors able to do it? Why are they able to get So really, it kind of creates this big old circle of information. Tell us exactly what you're doing. It justifies the cost. It quantifies your value. It shows how you are compared to your peers. And then, from there, we can align some incentives and really make it worth your while, not only for you as a provider, but to the hospital as well. If they want to participate in value-based care, if they want to partner with ACOs, or if they want to align themselves with a certain payer or Medicare Advantage plans. So there's a lot of opportunity there, and it all comes down to what they do day to day at the bedside by the patient, documenting those little things. And hopefully it'll be more automated with ambient technology in the future.
It will, right? And it makes me think about it's very much in alignment with what we do in our philosophy is that humans are inherently flawed, right? And if you look at any professional athlete, they all have coaches, right? And they all have coaches to kind of be a mirror to see themselves, because we can't necessarily see within ourselves what we're missing, right? And so what's coming up for me as you're saying this is you're really building that technical mirror for these people to kind of see how they can improve and how they can become more efficient and how they can make that bigger impact, because we all have cognitive bias baked in, and we get into this tunnel vision and we operate in a certain way, and it's hard for us to kind of see where we're missing the mark. But that data is so powerful because it gives that insights. And then, like you said, you can measure against your peers, and it can give you a source of information like, wait a minute, like, why is this off? Where do I need to look, and what am I missing, right? And then boom, you make a shift, you innovate the way that you're operating, and then everything is incremental improvements. And so it's extremely powerful as AI develops and all of these technologies continue to get more and more powerful. If we don't have that data, if we don't have clean data and good data governance, this technology is not going to be able to ingest that, and you're not going to be able to pull the value out of it. But the fact that you guys are doing this now, it's very powerful, because then you're going to be very aligned, right, with leveraging these technologies that bring that value to everybody in the process that's involved, including the end client. And we all know insurance companies, right? Like, they're going to try to get out of paying or whatever, right? So if you're incorporating that in it's a very well-rounded solution to help in a lot of areas. And with Microsoft being 49% owner of OpenAI, the power of that is going to be tacked on to embedded. It already is embedded into the Microsoft solution. So I see a huge opportunity there of just continuous improvement and innovation and just more value add for everybody involved as time goes on.
I like how you said the glass. That's a really good way to or it's a mirror of
Yeah.
you know, and looking at a coach. We have a. You reminded me of a story. I was in a meeting yesterday with our chief medical officer, who goes to our hospitals, multiple hospitals throughout the U.S., and he'll visit and he rolls up his sleeves and he works there along with the other doctors. He left after doing a shift at a hospital for a week and then came back the following week. And one of the things that we do is we put up all those analytics, how the doctors stand up against one another, up on a big screen as they come into their doctor's office. And he was the low guy on the totem pole because he had one particular patient that actually exceeded lengths of stay and coding. And just, you know, there's always those situations and stuff. But having that transparency, the other physicians were able to tease him a little bit, chief medical officer coming in, looking at our operation. But it builds also a trust and a camaraderie. It builds a better working environment. People know where they stand, you know, compared to one another. And these doctors are all in it. They're in that for the right reasons. I don't think that they don't, you know, complain about technology because, you know, they hate technology. I think that, you know, they are wanting to do the right thing by the patient, and doing something like that, building something that helps them understand the value, and to make it fun and also make it meaningful was one of the things I loved hearing that story. You know, hearing how they are trusting the data, and then they are, you know, they're self-correcting. They're scientists. That's what they want. They want to do the right thing. They see the data. They're going to fix it, not without somebody actually having to. It's the coach, like you said. You know, I was going to say it's not a person, but it's the actual technology being that coach.
Yeah.
Yeah.
Yeah. Yeah. That's huge. That's awesome. So let's talk a little bit about cloud computing. You know, can you discuss some of the benefits and challenges of utilizing cloud computing for healthcare applications, what you guys do?
Yeah. Well, for us, you know, when we started off the company, it was about 15 years ago. It was all on-prem. You know, you develop everything on site. You have your servers and you have your network and you manage all of that. And we still do that to an extent, but there has been a big push to get everything up to the cloud. And it's definitely had its benefits. For sure, we pushed as much as we could up to the cloud because it actually is less expensive and we don't have to worry about our small network team managing, keeping up our network, keeping up our servers, staying up to date with all the security patches. And so just from a practical perspective, it's allowed us to be able to focus more on our core business and not actually doing the day-to-day maintenance of keeping a you know, the servers up and running and things. And so we started to push everything out there, and we are, again, a Microsoft shop, but we have our data out in Azure, and a lot more services, a lot of more things have been pushed out to Azure. The benefits are, you know, I think one of the things that's been meaningful for us as a company is we really focus on secure. Obviously, it's healthcare. We focus on HIPAA standards, but we actually went through high trust certification to make sure that our environment and our application is really protected and adhering to the highest security standards. And pushing it out to the cloud helped us achieve a lot of those things because of the inherent controls in the Azure environment. So we were able to leverage a lot of that and take advantage of that. Work with somebody that was obviously that understands. Work with the Microsoft understands, and they assigned representatives and CSRs to us so that we can work with them to make sure our environment is high trust certified, and then we work with a third party to attest and confirm all of it was. The backups, the disaster recovery, being able to do redundant environments, not only in one cloud environment, but to another in a different location or a different region within their environment has been beneficial for us as well. Without us having to do that, And then I think I joked around with you earlier about, but they're also saying, hey, bring it all back to the ground as well. It's good to have it out there, but you probably should have a lot of backups here locally as well. And so I think it's definitely a balance of pushing everything out and bringing it all back and making sure you really understand where your data is at, what they can do for you, what those cloud environments, what the benefits are, and their limitations. Take advantage of those benefits and then plug in the gaps and find that balance for you and your organization. For us, it's heavily out in the cloud with a lot of backup and just some local services brought in our corporate office or in some remote business office as well. We have some small backups there. Otherwise, our applications are in the cloud.
Yeah, it's just part of the puzzle, right, of being able to bring that service and protect data and have everything secure and working effectively. And if you have an outage, of course you need to get things back up quickly, right? Because you're talking about patient care here, and it's a different animal when you're talking about that, especially if you're supporting potential surgeons and stuff like that, where people could be on an operating table, right? Like all of these things are very unique to the healthcare space, and we totally get that because our clientele is primarily healthcare, but it's you're dealing with people here, so it's a little bit more of a sensitive matter, right? When you come to patient care and data and all that stuff, protection.
When it came to the patients, we from the get-go knew that that's where we were putting our application. It was always going to be in a place with a certain SLA guarantee, certain uptime guarantees, all of that type of stuff with backups, making sure that that's there. But from our corporate resources, our corporate environment, corporate tools, all of those type of things, we started to push as much as we could out to the cloud, a lot for the same reason. In fact, even our phone systems ended up getting pushed out to the cloud, and then now phones and telecommunication and all of that is all pretty much managed in the cloud as well. So
Yeah, nice.
yeah.
So let's talk a little bit more about value-based care. We've talked a little bit, about it today, but in your perspective, like how does, like from a value-based care perspective, how does it really impact the roles and responsibilities of different healthcare providers throughout your organization? Or could you just shed light on any strategies that are kind of involved in that?
Yeah, value-based care, it kind of strikes a chord like the word innovation to me because it's a buzzword in a lot of ways too. You hear everyone should be focusing on value-based care, but how practical and how real is it, when it comes right down to it. In a fee-for-service based world where we have all come from, it's specifically in a hospital, it's been tough to participate in value-based care because truly a lot of the incentives for value-based care don't apply in those environments. And getting the doctors, you really need to coordinate the care of a patient amongst all the stakeholders. And I think that's been the biggest hurdle. And one of the good things about technology, frankly, that has come out that we can provide the bridge of communication and the coordination of care amongst all the different specialists and all the different environments as well. Because, for example, we just got approved by CMS to become a convener of our own patients in value-based care. And so we're exploring that and identifying which patient populations will be participating and we will be going at risk at in certain environments and certain places. And so we're identifying how we're going to handle that. And when we define those patients, we need to define what environment are we in, who are the other providers involved, who are the other consultants, does the hospital have a long-term care facility or a SNF or a place where patients can be discharged and still get the appropriate care? Or do we develop those networks ourselves? Do we reach out to the primary care physicians around the hospitals and make sure that when we discharge these patients that they actually are going to their primary care physician? And so what we've done is we've built our tool to not only identify when a patient is one of those patients that's triggered a bundle that is a BPCI or a value-based care case, and then be able to follow that patient through their stay at the hospital, communicate with the primary care physician immediately that we have this patient, coordinate care with them, saying, hey, we think this patient will be discharged in 2 days. We'll discharge them to home. At that particular point, you have 7 days. We recommend within 7 days maybe a visit, or maybe do you have a clinic that you would like them to go to, coordinating that care. But the reason I mention all of that is we're identifying those patients and those places where we can truly improve the value-based care, really be a part of that whole value-based care agenda, and really go at risk. And we want to make sure that those patients that we've identified get the proper care. And being that we are the initiator of that particular bundle, because it happens in a hospital, we have skin in the game. And so we need to dedicate resources, dedicate our technology. We're building more capability within our technology to communicate and coordinate care, to not only provide the PCP access to our data, share our data to health information networks and health exchanges, share our data with payers that may be involved. You mentioned the insurance companies. And then also assign operational teams that are looking at those data and analytics and watching, hey, where's that patient presenting? Where did they go next? Did we follow up with them within a certain time period? Did they get readmitted? Can we avoid the readmission? Can we make sure that they go to a clinic instead of being readmitted back into the hospital, where it would cause administrative and it would be something that would be the hospital will not get reimbursed for that readmission, and so it's really an expensive proposition for them to have to come back to the hospital. We don't want that. The patient doesn't want that, so we want to do the right thing for the patient, and so technology can be there to improve that communication between the providers involved, the specialists, the nurses, and the nurse navigators that we have assigned to those patients.
Nurse navigators, I like that.
Yeah, we have a nurse navigator whose sole responsibility is really identifying those patients. At the time that they are in the hospital, they've triggered a bundle, we want to follow them and we want to make sure that they get the appropriate care. And so it's important to us. It's what we've been doing all along, frankly, and the way that our technology has been built, and the way that our doctors and our providers are incentivized is to understand that they are a part in that. And if we're able to save money and get some bonuses or get some additional reimbursement from CMS, that they're going to take part in that. And so again, coming back to showing the data, showing how they affected that particular patient or that group of patients and how they can benefit in the upside of it, helps us really truly align care for the hospital, to our providers, to us as an organization, and the technology is what does that.
Yeah, and as you were explaining that, what was coming up for me was it's the complexity of the industry, right? You're dealing with people, extremely complex, right? But then you start talking about the healthcare industry, the insurance industry, doctors, all the healthcare providers, all working like together in kind of unison to provide that care. The data is so important because it's such a complex, it's so much stuff to process and think about, right? Just the human body alone, just the patient care alone is extremely complex when you talk about the human body. But then you add all these other complex things onto it. And I see that the power of this technology is going to help with all that processing power and insights to really collectively move the industry forward. I mean, we've been seeing it happening for years, but I think it's accelerating and amplifying everything.
It'll take some time, obviously. All the providers need to trust one another. That getting back to that whole ambient technology, if we're able to share that note that we created with ambient technology to the next care coordinator, and they feel good about what's been documented, then we might have saved that second doctor from a whole new history in the physical, a whole new exam. He understands what's been prescribed. He understands the lab work. We can share all that information and build some efficiencies, and that's where you get the value and the cost savings and the better outcomes for the patients.
Absolutely.
At a cheaper cost for them too, which is the goal.
Yeah.
Right.
Yeah.
Yeah.
So, we're coming up on kind of time here, Merced. So, as we kind of transition out in this episode, in your opinion, what technology does the world need that doesn't exist yet?
Wow, that's a hard one. I jokingly, I'd probably say, "Hey, we need teleportation." So, that would be a great technology. I would love.
Yeah, I'm working on it.
If somebody's on it.
I said I'm working on it.
Oh, great! You are. Then I'm
That
with
and
you.
time travel.
We need we need to identify and make sure that it's safe for humans. If it's safe, then we'll take on that technology. Or maybe it's just about teleporting meds, or maybe teleporting, But jokingly, I joke about that, but I think that's ultimately the goal, like being super efficient about getting services or products or things that people need into the hands as quickly and as efficiently as possible. Teleportation is probably not going to be the thing, but boy, I think Amazon's got a pretty good step with their drones and the way they're delivering that technology. Maybe there's something there.
I've been having some delays over the last week or so. It might be slipping a little bit.
Maybe those holidays may be doing that.
Yeah. They need a risk mitigation plan for holiday delays, I would imagine. But
that's great.
I know, and it's it's funny you say that. As far as I'm concerned, like science is proven, and Einstein and quantum physics and all this stuff has proven that teleportation is actually possible, kind of, right? But it's interesting when you start digging into that stuff and you look at the mechanics of reality and quantum physics, and it's interesting stuff for sure.
It's exciting to constantly be curious and learn and try to get those things that we don't know. Just keep innovating, keep being curious and learning, and maybe some of the cool things like teleportation will become a reality someday.
I'll go ask ChatGPT what I need to do to create a teleportation device.
That's a great question. We'll see what it says. That'd be great.
So Merced, thanks for joining us today and sharing your insights. If anyone is listening and truly dedicated to value-based care and enhancing healthcare efficiency, I believe, and I hope that you understand, like just through this conversation, what HNI Healthcare is doing, that they could really be a valuable partnership to explore for you and your organization. Merced, can you give us any insights into what I just said?
Sure. I mean, if anybody wants to reach out to HNI, they can go to our website. It's hnihealthcare.com. We've got a section there that's really, there's a learn section that you can learn a little bit about us as a company. You can learn about our leadership. You can learn about some of our case studies and some of the services that we offer and all the different service lines. And they can learn about our technology. They can learn about our people. We're one of those companies that also has that people, process, and technology kind of trifecta goal, that we believe we're a technology company at the foundation. But we have great managers and great employees that have been with us, that understand value-based care, that understand healthcare, and work really closely with our hospitals and our patients to provide better health outcomes. So I would say go to our website, reach out to me anytime via LinkedIn. Happy to chat with anyone about HNI or about technology or about healthcare. That'll be pretty much it.
Appreciate that, Merced. So listeners, be sure to check out his work and follow him on social media. Website links and social handles will be in the show description. So finally, from our conversation today, Merced, what is one piece of actionable advice that you want to leave the audience with?
Maybe something for me that I'm kind of still working on. For me, it's always I'm working on. It's going to sound the opposite of really focus on what is essential for you and your organization, what is really important, and learn to say no to a lot of things. I have spent a lot of time trying to be a yes man, on a lot of things. And sure, we could do that. And I've gone down a lot of rabbit holes and spent a lot of time trying to develop something or come up with a solution that may not have been the best. Trust in yourself. Learn to identify what is truly essential to you and what's important to you, and then say yes to the things that are really important and essential. Start small, and then start building on that, and you'll probably end up with a pretty happy life and a pretty good product, and something that's hopefully helping society and making the world a little bit better place.
So important these days. There's so much noise and so much opportunity and so much information coming at us from all directions. So thank you for that, Merced, and reinforcing that. And listeners, don't forget to help your fellow tech humans. Share this podcast. Follow me on LinkedIn at Javier Guerra 360. See you next time on the Tech Human Experience.
The Tech Human Experience